Il me fait plaisir d'ouvrir
So it's my pleasure to open the symposium on primary care policy so that we can discuss and develop a common vision for primary care in Quebec.
Vice Dean and Vice Principal, Associate Vice Principal for Health Affairs in the Faculty of Medicine at McGill University, Vice-Principal Adjoint et Vice-Doyen Exécutif Santé et Affaires Médicales, Faculté de Médecine.
Associate Vice Principal and Vice Dean of Health Affairs, the Faculty of Medicine of the University of McGill.
Alors, la salle est comble. Bonjour à tous. Welcome to all.
We have a full room today. Good morning, everyone. I welcome Madam Principal, dear colleagues. And when I say dear colleagues, I'm referring to everyone here. We have young people, a few more mature individuals, and others that I would refer to as archives. On behalf of the Faculty of Medicine of the University of McGill, Ruiz, the Integrated University Hospital Service, I welcome you.
Anniversary of the Department of Family Medicine, in part with this very relevant symposium. At a time of major and at times we can say turbulent healthcare reform, it is relevant and important to review the historical context of what we're doing, to compare, to reflect, and to plan for the future. Nous sommes ravis de voir la diversité des...
We're very pleased to see the diversity of the environments you represent and the many disciplines that you work in. This should provide for very rewarding and creative discussions. This symposium underscores the importance of family medicine at McGill and Quebec society, and it's also an opportunity to see how family medicine has evolved over time. And last evening, I had the honor of attending the 40th anniversary celebration for the McGill University's Family Medicine Department at the Fine Arts Museum of Montreal. It was a very joyous and proud evening for everyone who was present, and there were over 100 of us. It was an evening where we we saw a number of things that are interrelated. We saw the civilization of old Pompeii, of course destroyed by a volcano many years ago, but nevertheless it was an extraordinary place and very full of life up until that point. And we had a very eloquent presentation on the challenges and hopes of space, given by David Saint-Jacques, an astronaut and family doctor. And we looked at why these new horizons are so important for the future of the human species. Now, conscious of these themes and of the importance of family medicine, we're here today, and we can ask the same questions about our objectives for our society, the best possible care for our fellow citizens.
In all cases, the role of primary care as an integrated and integrating element is seen as a key to success. The question is, how does one get it right? Today, with our distinguished guests and with yourselves working, that question will be asked in many different ways. The objective is to define the elements which can and which will ensure optimal health care delivery to those we all serve. Un petit point ici, comme coordinateur.
Just as a point, as coordinator for Reese McGill, I would point out that the role of Ruiz is summed up in its acronym. It's a university network of integrated health care, bringing together partners and their expertise so that everybody can work together to come up with the best solutions. Obviously, with this and with your cooperation today, I think our discussions represent value added for our society, and I would like to congratulate Dr. Howard Bergman, who worked with the organizing committee for an entire year, putting the symposium together, our department head at the Family Medicine Department at McGill. And I would like to thank and congratulate the steering committee who developed the scientific program. Thanks also to our speakers in attendance, and thank you, our attendees, for participating and for helping us come up with practical solutions to the issues we're going to be talking about. Thank you, and have a great day.
It's now my great honor to introduce to you the principal of McGill University, Suzanne Fortier, principal and vice chancellor since September 2013. And I'm very honored and appreciative that she has taken the time to be with us today. And the principal and her office have been extremely supportive in the organization of this meeting. Just a few words about Suzanne Fortier. Prior to her appointment as principal, Professor Fortier was president of the Natural Sciences and Engineering Research Council of Canada and held the position of vice principal academic and vice principal research at Queen's University. Elle est originaire de Saint-Timothée, en Montérégie.
She is a native of Saint-Timothée in Quebec, and there's something very special at Saint-Timothée. I'm not sure if it's the water or what, but l'ange Jean-Baptiste Laviolette, one of the founders of the Montreal Canadiens, comes from here. Paul-Émile Léger, the cardinal, Armand Frappier, of Born-Beauty fame, Madeleine Parent, Jean-Luc Brassard, and Mélodie Daou. She's the youngest. She's with the. She played with the Canadian women's Olympic team at Sochi, and she has continued to be a remarkable athlete. So congratulations to Saint-Timothée, and thanks to Saint-Timothée to have given us Suzanne Fortier, who did her studies in science at McGill. She's had several honorary PhDs. She's had a Diamond Award from Elizabeth II. Elle a été
Society of Canada. Donc, elle est maintenant aussi, le professeur Fortier est maintenant aussi membre et vice-président du Conseil des sciences, de la technologie et de l'innovation, qui est un organisme extrêmement important en termes de développer la politique sur les sciences et technologies. Alors, il me fait grand plaisir de vous présenter Madame Professeure Suzanne Fortier, principal de McGill University.
Merci, Dr. Bergman. Et merci à vous tous de votre présence ici.
Thank you, and thank you for being here for the symposium. And welcome for those who are from outside of Montreal. Welcome to Montreal, to McGill, and to the symposium. I would like to share Saint-Timothée's success. It's not the water, it's our maple syrup. I have to do a little advertising for my own town. But I'm very pleased to be here for the 40th anniversary for the Department of Family Medicine at McGill, and to pay tribute to all the people who built the department, obviously the students, the teachers, practitioners, and employees from the past and from today. Congratulations to all of you.
Family medicine here at McGill, but also through this province. We know that this has been led by many, many people, and including many people who are taking part in this symposium. I think you all know that in the early 1970s, there were only a handful of students who wanted to pursue their interest in medicine through family medicine. And this has changed drastically. I think today, half of the students have chosen family medicine as their area of specialty. Isn't that a great achievement? Quand on y pense, on est parti de loin.
We started very modestly. We didn't have enough, from the patient's point of view, enough people choosing family medicine. And now almost 50% in our 4 faculties of medicine in Quebec choose family medicine, and we're all very grateful for ourselves and for our families. At the McGill Department of Family Medicine, it's the largest of our departments in health at McGill, and we are very pleased to be in the service of the community and to be very committed to the community. The department has a very long tradition of excellence in healthcare for the benefit of Quebecers. Quebecers of all origins, and more specifically people who are disadvantaged, immigrants, and native or Aboriginal Quebecers. We're very present in certain neighborhoods of Montreal where we didn't look at all in the past how they do today, like Griffintown, Pointe-Saint-Charles, for instance, where our family medicine department went out to provide health care to people who really needed it. And over the years, we've gotten to the point where we have 200 residents in our department who provide care to over 100,000 patients throughout Quebec, even in the far north.
Primary care is at a crossroad in Quebec. In 15 years, there has been a major paradigm shift in clinical care that recognized family medicine at the point of first and often only entry, only contact for the population. And this is something that we know as a province, as an institution like McGill, and also as a patient. Je vais vous dire, dans mon petit village de Saint-Timothée, vous savez, on a...
My little town of Saint-Timothée, my wisdom is the wisdom I acquired as a child in Saint-Timothée. We all do that, I think. There was a person that we depended on a lot, who was trusted and respected by everybody in the town. If you asked who's the most important person in Saint-Timothée, everybody would have said our family doctor, because we were lucky in our little town to have a doctor who practiced locally. So as everybody in Saint-Timothée knew that he was there for us, which was important because most of the inhabitants were rather poor. Not everybody had a car to be able to get to a hospital or whatever. So it was a major asset for everybody in the town.
Sustainable healthcare system, and what we need is a common vision for the province here to effectively advance our mission together. And this symposium provides all of you what an opportunity to develop this vision together. Permettez-moi
allow me to congratulate Dr. Bergman and his team for this wonderful anniversary, 40 years. Dr. Bergman, well, 40 is pretty young, after all. So we're expecting that this 40-year-old will still do great things, in addition to the great things that have already been done. Enjoy your anniversary. Congratulations, and
Merci beaucoup, Suzanne Fortier. Encore
thank you very much, Suzanne Fortier, and thank you for your support as principal and the principal's office for this event. and of course their support for the Department of Family Medicine. I would like
Director of the Institute for Health and Social Policy at McGill University. Daniel?
Merci beaucoup.
Thank you very much. I would be remiss if I didn't start by taking a brief moment to think about the people in Fort McGill. We are going through something that we have a great deal of difficulty even imagining, and the primary care people who are risking their lives to attempt to mitigate the consequences of the tragedy that they're going through. As Howard said, I'm director of the Institute of Health Policy and Health Research, and I'm very pleased to be that our institute is involved in the 40th anniversary events. We're the younger brother. We've only been around for 7 years. So we're young compared to the people around us, but it's an honor to be associated with with the department. Years ago, when I decided to pursue my career at McGill, I met Howard. We'd met previously, but I met him at the airport. You can often find Howard in an airport. He was going to somewhere exotic, China, Saudi Arabia. I think I was going to Duluth myself. And Howard said, "Oh, you're coming to McGill. We should do something together," he said. And here we are together. This is the culminating point of a very wonderful cooperation between the department and the Institute. And it's not the end, I hope. I think it's just the beginning of our relationship. For the Institute, there are scientific reasons why this event is important for us.
Understanding the conditions that sustain a healthy community means understanding the social determinants of health. And it is my belief that there is no more important a social determinant of the health of a population than the way in which it chooses to organize its healthcare system. And we are very, very excited at the idea that we will, through this event and through collaborations to come, be developing this aspect of our research program. It connects with the scientific mission of the Institute in a number of ways. First of all, we are committed to the idea, as we should all be, that understanding how we should organize our healthcare system is something that should be resolutely evidence-based. We should be looking both to evidence here and evidence abroad to see what good ideas people have had both close to home and further away to meet the very considerable challenge of organizing primary care system for a population marked by the demographic transitions that we know. And so for the Institute, the idea that we should really be collecting evidence from here and from around the world is a very important one, and you'll note that that comparative international perspective is very present in the program that we've assembled today. The other way in which this connects very much with the scientific mission of the Institute is that we really believe that today's problems in healthcare and in policy in general can really only be tackled in a resolutely interdisciplinary way. We all have pieces of the puzzle, and the challenge for universities is to find ways to put those pieces together so that we can actually make sense of a complex picture. We've tried to do that in the Institute, and the collaboration with family medicine is, I think, crucial to putting those interdisciplinary pieces together. But it's also something that requires the contributions not just of us sitting up here or standing up here, but of all of you. Howard has mentioned that it's something that we thought was absolutely central to the organization of the event, that there be enough time for discussion, both today but going forward. We really want this to be the beginning of a discussion rather than the beginning and the end of one. We are going to be making use of technology which I am only an extremely mediocre understander of, namely Twitter, in order to get that conversation going. There is what I am told is referred to as a hashtag. that has been associated with the event. You have it up on the screen. Well, you probably have my face up on the screen, but when I leave, you will have the hashtag on the screen. It is McGill, hashtag, McGill Fam Simp. Please feel free to, I'm told the correct word is live tweet as we, there we go. As we go through the day, we have I'm going to be chairing a session at the end of the day where we're going to be collecting and giving everybody a sense of what the sense of the room has through the live tweets. So if you want to be present up here on the stage, start tweeting, and our tweet editor, I guess, will be here later in the afternoon to tell us a little bit about what you have said, what you've heard, and what you've thought was most important to tweet about. But this is just by way of saying that we think that it is important that we have a conversation, an interdisciplinary, international conversation about the best way in which to organize primary care. We're going to get it right to the extent that we all bring our contributions to the solving of problems related to primary care. The solution is too big to be the fact of just one person. It's got to be a contribution of all of us, and we hope that through this conference we will be doing our little part in getting that conversation started. Thank you very much.
Thank you, Daniel. Principal Fortier said that primary care is at the crossroads in Quebec, and in fact there's been a major paradigm shift that we now recognize primary care, family medicine, as the foundation of a sustainable healthcare system. Plus de 260 groupes de médecine de famille couvrent maintenant près de 50% de la population.
More than the number of family medicine and primary care practitioners has gone up, but it's been a very
FMOQ, two management frameworks that are not very known in the public. We have yet to understand the full impact of these changes on the practice and teaching of family medicine, but in particular and most importantly, on the quality of patient care. Successful policy and its implementation require developing a shared vision in the population among those working in the front lines in the healthcare system. Successful implementation also requires iterative improvement through accountability and population input. Yet, in spite of the importance and the intensity of the primary care reforms, many observers have noted that there has been essentially no attempt to engage the population and the stakeholders, which has led for calls for open, nonpartisan, and respectful public policy discussion on healthcare reform. C'est pourquoi le département de médecine de famille de McGill organise ce symposium vers une vision commune.
That's why McGill thought it was important to organize a symposium towards a common vision, to bring together various points of view, patients, health professionals, health system managers, and decision makers, to discuss the issues and possible solutions.
Symposium. In fact, we had to close registration and have over 20 people on webcast, and I'm hoping the webcast is working. I'm happy to say that we have, as I indicated, a very diverse audience from very many different regions and universities, the general public, clinicians, administrators, academics, and people from industry and government. Je suis particulièrement emballé du fait qu'environ un tiers des participants.
Fully one-third of participants are what we now refer to as learners, students of medicine, residents in other specialties and in family medicine, doctoral students and postdocs. They recognize that they hold the key to the development of their own careers.
We're doing, we have family medicine units based in Montreal, Gatineau, Châteauguay, and Val-d'Or, treating diverse community and patient population with over 100,000 registered patients. But what is in addition, what is extremely unique to our department is our research and graduate studies program. We have over 50 master's, PhD, and postdoc students in our master's and PhD programs. It's unique in the world. It reflects our commitment to improving the health of the population or healthcare system through a community and patient-centered approach. So we're excited today to celebrate this milestone of their 40th anniversary with an exercise that exemplifies the heart of family medicine, reflecting on actions that take us from evidence-informed practice to policy and back again to collectively co-design our future. I want to especially thank our speakers and moderators for their generosity et pour leur patience à recevoir tous mes courriels.
Thank you for participating and for coping with my deluge of emails.
From England and far away from Ontario. Une grande appréciation à trois personnes
Special thanks to three people who have continued to contribute to the evolution of our health system: Claude Castonguay, Jean Rachon, and Michel Claire, who headed commissions on the healthcare systems in 1985 and 2000.
Dr. McGill was my dean when I was a medical student several years ago. Merci encore une fois à Principal Suzanne.
Thank you once again to Principal Suzanne Fortier for her presence.
There's an expression that came out of a movie that everything will be okay in the end. So many of you have heard this before, right? Everything will be okay in the end, and if it's not okay, it's not the end. So I want to acknowledge our partners, the Institute for Health and Social Policy, Daniel Weinstock, St. Mary's Research Center, CIUS West de Lille, Susan Law, Benoit Morin, Cindy Starnino, Lynn McVeigh, the McGill Faculty of Medicine, Dean David Eidelman, who will be with us later on today, Louis McGill, Sam Benaroya, McGill Ingram School of Nursing, and the McGill School of Dentistry, Dean Paul Allison. And we've received support for the symposium from the Canadian Institutes of Health Research, CIHR, a grant from them, and from the Collège Québécois des Médecins de Famille. I'm not going to name each of the members of the program committee. You can look at it on our on the program, but I want to thank each of them because we've all put in a lot of work over the past year. I want to particularly thank Rachel Simmons, who's behind the organization of this